China is once again making headlines, but this time, it's not for anything we want to hear. Remember when COVID-19 first hit and the world was thrown into chaos? Well, brace yourself because there's a new virus in town, HMPV, and it's already spreading like wildfire. Hospitals are filling up fast, and the fear of another global crisis is creeping back. Is this the next big threat? Let's break it down, uncover the facts, and find out what we need to do to stay safe before it hits even closer to home. First things first, HMPV stands for human metapneumovirus. It's a respiratory virus that mainly affects the lungs and airways. Discovered in 2001 in the Netherlands, it's not exactly a new virus, but it's one that hasn't gotten much attention until now. HMPV belongs to the same family as RSV, respiratory syncytial virus, so its symptoms are pretty similar. For most people, it causes mild symptoms like a runny nose, coughing, and fever. But for babies, older adults, or anyone with a weak immune system, it can become more serious, leading to bronchitis or even pneumonia. Think of it as a virus that's always been in the background, but is now stepping into the spotlight. Here's where things get interesting. Recently, hospitals in China started seeing a surge in cases of respiratory illnesses in children. Initially, people thought it might just be a bad flu season, or even RSV, but testing revealed that many of these cases were actually caused by HMPV. Doctors are reporting packed pediatric wards, with children struggling with severe symptoms. This has raised alarm bells because, for some of these kids, the virus isn't just mild, it's serious enough to require hospital care. Why now? Well, one theory is that during the COVID-19 lockdowns, people weren't exposed to as many viruses. Our immune systems got a bit of a break. Now, as restrictions have lifted and life returns to normal, viruses like HMPV are spreading more easily. Now, China might be the current hotspot, but HMPV isn't confined to one country. Reports of HMPV cases are popping up in other parts of the world, including Europe, the United States, and even parts of South Asia. In fact, recent studies have shown that HMPV is more common than we thought. It's just been underdiagnosed for years. In the US, for example, the Centers for Disease Control and Prevention, CDC, has identified HMPV as one of the leading causes of respiratory infections in children during the colder months. This isn't a China-only issue. It's a global one. And as winter sets in, we might see cases rise in other countries too. Here's the bad news. There's no vaccine for HMPV. Unlike the regular flu or COVID-19, which now finally have vaccines to help prevent severe cases, HMPV is still waiting for its medical breakthrough. Scientists are working on it, but for now, there's no specific shot to protect against this virus. As for treatment, it's mostly about managing symptoms. For mild cases, that means rest, staying hydrated, and using over-the-counter medicines for fever or congestion. For more severe cases, particularly in children or the elderly, hospital care might be needed to provide oxygen or other supportive treatments. The key takeaway: prevention is better than cure because we don't have a magic bullet for this virus yet. HMPV spreads in various ways, starting with respiratory droplets. When an infected person coughs, sneezes, or talks, tiny droplets containing the virus can land on others. It can also spread through touching surfaces like doorknobs or phones, and then touching your face. Close contact, such as hugs, handshakes, or sharing utensils, can also transmit the virus, making crowded places and daycares common hotspots, especially during colder months. To protect yourself from HMPV, wash your hands frequently for at least 20 seconds with soap and water. Avoid touching your face, and disinfect high-touch surfaces regularly. Stay home when sick, wear a mask in crowded places, and boost your immune system with a healthy diet, exercise, and enough sleep. By following these simple steps, you can reduce the spread of HMPV and keep yourself and others safe. HMPV may not be as widely known as COVID-19, but it's still something we should keep an eye on, especially for those at higher risk. With no vaccine currently available, staying informed and following simple precautions is crucial. Are you doing enough to protect yourself and those around you? Drop your thoughts in the comments. If you found this video helpful, Make sure to hit the like button and subscribe for more updates on health and safety.